Well, good afternoon, and thanks again for joining us today. Today, I want to reiterate some of our data points and then talk about testing and how our Virginia National Guard is helping. Tomorrow, believe it or not, marks 2 months since Virginia had its first positive COVID case. In those 8 weeks, our lives and our world have changed a great deal. We're now at a place where we can think about our next steps. On Monday, we extended our current restrictions by a week and broadly outlined our Forward Virginia plan. That is our phased approach to restricted operations for businesses and limited gatherings that we will implement in phases over time based on data and science. We will provide more detailed guidance on those phases and restrictions on Friday. We continue to work with businesses and workers to ensure that there is confidence in the next steps when we take them. We're also working with our localities. I know that across Virginia, our localities are being affected in very different ways. I want everybody to understand, when we do detail what Phase 1's restrictions look like, we regard that as the floor. If local governments, based on the situation in their own localities, feel that they need to maintain additional restrictions on gatherings or business operations, we will allow that and we will work with the localities. So we are talking to localities, including in Northern Virginia, to discuss those issues. I want to emphasize that we are closely monitoring the health metrics as we proceed, and decisions that we make are dictated by that data. A few weeks ago, I said we needed 2 weeks of decline in numbers to move forward with Phase 1. That is based on CDC guidelines. We are seeing that, and I hope we will be able to enter Phase 1 next Friday, the 15th of May. But we will continue to closely monitor the data to make that decision, as we do with all of our decisions. As a reminder, here's what we're measuring. We're looking at the percent of tests that are positive. We want that to be steady or a downward trend, and we are seeing that. We're looking at hospitalizations due to COVID-19. That is stable. We're looking at our hospital's capacity of beds and of ventilators, and that also remains stable. We want to have an increasing and sustainable supply of PPE, and for the last few days, no hospitals have reported having difficulty getting PPE. And finally, we want to have an increasing ability to test and trace. We're significantly increasing our testing, and we plan to hire over 1,000 contact tracers. Health is and will continue to be our first priority. Our next steps depend on our testing, tracking, and ability to quarantine. So I want to highlight some of those efforts. On the Eastern Shore, we continue to be concerned about cases in the poultry plants. Our health department is working with the CDC team as we speak. The two companies are conducting large-scale testing for plant workers, and we should get those results in a few days. The health department is going to be testing in the Eastern Shore community as well in the coming days. To increase testing, we don't just need kits. That's certainly an important part of it, but we need the people to perform those tests and to send them to the labs. For that, we've been partnering with our Virginia National Guard. The Guard provides the manpower and the logistical expertise. Recently, the Guard has helped with 12 testing events in communities like right here in Richmond and over on the Eastern Shore, and in congregate settings like Sussex 2 Prison. Under the federal Title 32 status, the federal government is helping pay for this assistance. We have this status through the end of May, but it is clear we'll continue to need this help. So today, I'm asking the President to extend this authorization. The National Guard regularly provides assistance in emergencies, and this is the greatest emergency that we have seen in many years. I am grateful for the service of our National Guard members. They are our neighbors, and they are also our friends. Today, we are pleased to have with us Major General Timothy Williams, the Adjutant General of Virginia, to explain more about our Guard's activities around COVID-19 in our communities. And again, before he takes the podium, these are men and women that are serving us so proudly here in the Commonwealth of Virginia. And so if you see one out in the neighborhood, out in your communities, please thank them for all that they're doing. Major General Williams, welcome.
Thank you, Governor. Ladies and gentlemen, good afternoon. I'm Major General Tim Williams, the Adjutant General of Virginia, and I'm here today representing the more than 9,000 Virginia National Guard soldiers, airmen, members of the Defense Force, and our state and federal employees. Before I get into the update on how our personnel are supporting the Virginia COVID response, I'd like to provide an overview of our organization. The Virginia National Guard is a unique dual status force with a federal mission to provide a combat reserve for the U.S. Army and the U.S. Air Force to fight our nation's wars, and a state mission to provide a response force that answers the call of the governor to defend the Commonwealth. We trace our lineage to the very founding of our Commonwealth in 1607. We are a community-based force with readiness centers and training, aviation, and maintenance facilities in more than 50 communities across the state. Here is a quick snapshot of our federal missions. Nearly 1,500 soldiers and airmen served on federal active duty in the last 24 months in Iraq, Afghanistan, and other locations across the globe. Our units conducted a wide variety of missions, including F-22 fighter jet air dominance, cyber, partnership building, sustainment security, rotary and fixed-wing flight operations. These 1,500 personnel join more than 15,000 soldiers and airmen who have mobilized for Homeland Security missions, combat operations, and peacekeeping and stabilization missions since September 11, 2001. Here at home, since 2001, we have mobilized more than 13,600 soldiers, airmen, and members of the VDF to respond to hurricanes, winter storms, flooding, and other severe weather events across the Commonwealth, as well as in neighboring states like Louisiana and the U.S. Virgin Islands. And now, our personnel are working diligently to support local, state, and federal efforts to mitigate the impacts of the coronavirus. While this is not currently the largest call-up of our personnel, it is certainly one of the longest. Today, we have approximately 570 personnel actively working or ready to support Virginia's COVID response. Our mission is to provide additional capabilities and expand capacity for lead agencies like the Virginia Department of Health and the Virginia Department of Emergency Management, who establish the priorities and assign the localities where we work. Our top priority is providing additional capacity for COVID test sample collection and mask test fitting at long-term care and correctional facilities, which are some of our most vulnerable population. We also have personnel transporting test kits at different locations across the state, as well as providing material handling support and commodity distribution and planning. When the governor declared a state of emergency, we immediately began assisting with operations, logistics, and medical planning in multiple VDM regions across the state, and those planning efforts continue. So far, our personnel have performed more than 22,000 hours of planning augmentation. About 100 Virginia National Guard soldiers and airmen with extension protocols received training from VDH and are supporting COVID sample collection and N95 respirator mask fit testing. At multiple locations across the state, we have collected samples from more than 2,700 people using provided kits and conducted mask fit tests for nearly 450 staff members at long-term care facilities, as well as delivering more than 730 sample collection kits. This week, we have personnel supporting testing in the Central and Northern Virginia areas. We will deploy personnel to support the Eastern Shore Health District in conducting drive-through testing on Friday and Saturday with the ability to test up to 1,000 people a day. Virginia National Guard personnel will collect samples for the test kits, and the Health Department will provide health protection information.